Hi, thank you so much for joining today. My name is Joseph Drasudis, and I'm going to be conducting a climate change and health, how they intersect each other and affect each other. And joining to me today will be my friend. So just before we really jump into like the gist of everything, so to say, I wanted just to get video documentation that you've received the release form that I provided you with it, and that you're doing this on your own free will and volition, and that nobody's forcing you, right?
That's right. Yes, correct.
Okay, all right, great. So now that we have that documented, let's just jump right into things. Okay.
Sure.
So yeah, once again, my name is Joseph Drasudis, and so let's begin. All right.
Yes.
So I wanted to start with a list of questions that I have here. Um,
Sure.
So I'm going to start with a list of prearranged questions that my professor provided me with. There's 7 questions in total. And then stemming from those questions, your responses, I'm just going to go on from there and ask a little bit more of my own questions. Just basically touching up on everything that you mentioned in those first few questions that I ask, okay?
Sure.
All right. So let's begin here. All right. So with the first question, can you start with your name? And like, what do you do for a living? Explain like what you like to do in your free time. Um, do you have brothers, sisters, mom, dad? What's family life like?
Oh, sure. So my name is Javier Navarro. I'm 41 years old. I live in the city of Chicago in the South Side. I have three sisters and two brothers, and I have a pit bull dog that takes up a lot of my time. So I do that as my free time. I work in a call center that specializes in, in the medical field. So what we do is we take calls from patients or other hospitals or nursing homes or assisted living facilities that want to speak to the covering doctor or the doctor on duty for orders, advice, things like that. So we get a lot of sick patients, pregnant patients, and a lot of nursing home calls in other hospitals. Yeah. So yeah, all that.
All right. So yeah, that sounds like a vast, different type of patients that you speak with. Awesome.
Yeah, we get a
All right.
variety.
Yeah. All right. Okay. So moving on. The next question is, so your current community now, you mentioned that you lived on the south side of Chicago. How long have you lived there?
I've lived here for about, say, 32 years. Yeah.
Yeah.
So a big chunk of my life I've lived here. Yeah.
Yeah, it's been a long time. All right. So that would be 1993, 1992,
92. Yeah.
92?
We
Okay.
came here, yeah, because of the hurricane in Florida. I used to live in Florida,
Yeah.
and yeah, and that's how we ended up in Chicago.
Yeah, so there was a hurricane. Okay, and that's what caused you to move to the south side of Chicago, right?
That's right. Yes.
Okay. Gotcha. All right. So taking into consideration living here in Chicago, like what environmental changes have you noticed since you started living here? So like compare that to how it was when you were a kid, like when you were a little kid, before you were even a teenager. Like what were conditions like here that maybe you wouldn't say necessarily are the same way now? Is there anything like that? Do you notice anything?
Yes. I mean, if I were to think about it, I'd say uh, the weather here is different from when I was growing up here. I mean, I remember growing up, we used to get a lot more rain, snow. I mean, our winters, they would look like, you know, Christmas.
Mhm.
You'd get the blankets of snow all over the streets. Everything looked just beautiful, and we don't get that a lot nowadays. I mean, I can't remember the last time we had a blizzard. I
Right.
mean, it has to be more than 10 years, maybe 12. I mean, it's been a long time.
Yeah,
So, I mean, that's one of the changes that I see.
I definitely agree. That's like one thing that I always mention is that like there's no snow. Like it gets cold, but like where's the snow, right?
Yeah, we
Um,
still get the wind. but no snow.
Yeah. And what about summers? Like, is there any difference in summers?
Uh, they start earlier. I feel like summers start earlier than before. Yeah, they've taken over the winter. Like the winter months have turned into summer months.
Yeah. Okay. I agree with you there. All right. So moving on. So the changing climate. So like the climate that was of our childhood and what the climate is now. So the changing climate, does it influence your daily life, would you think, in a big way, in a small way? Um, is it something that you think about often?
I not in a direct way, um, because I mean, when I think about climate, I think about the weather, and I do pay attention to the weather. I mean, I when you leave the house, I check the weather, see what I can wear, what not, if it's gonna rain. So, I mean, that's I guess the main reason that I would think about climate is it's just what's the weather gonna be like? Is it gonna rain? Is it gonna snow? Is it windy? Is it sunny? So in that aspect, so it does play, I guess a big part.
I understand. So like you would say in like maybe the day to day, the daily aspect of it and how it impacts you, your immediate thought is, what do I need to wear to like
Yeah, I
circumvent
mean
this?
when I'm leaving the house,
Okay, so
be weather ready.
not necessarily like over a long a period of time. You're not really looking at it in that manner, just how it impacts your day. Like what do you need
Yeah.
to put on before you go outside? Okay, I get it.
Well,
All
I guess in the big picture, I mean,
right. Pardon me.
I guess I mean I try to recycle. I try to do my part in the environment. So there's that.
Okay.
So I mean so there.
All
Yeah.
right. Good. Also, I wanted to mention too, if you see me just like jotting stuff down here, um, don't mind me. I'm just taking notes.
Yeah,
Um, yeah. All right.
no problem. I understand.
Okay. All right. So like maybe going back a little bit in time, um, so like in regards to your specific situation, back to the hurricane. I think it was Hurricane Andrew, right? That was the big one,
Yes,
South Florida.
that
Yeah,
was the one. That was the
in,
one, yeah.
in South Florida around that time. Yeah. Um, that was a big one. Um, so how has your health been impacted by climate change? Like, how has that impacted your health?
Well, I I have anxiety. That's and I attribute that to the whole displacement moving here from another state. That was kind of pretty traumatic on me, having to experience a new environment and watching your parents struggle, because through evacuations you have to move quickly and get what you can. So
Right.
you only bring the necessities. You don't bring, it's material things, but I left, everything was gone.
Yeah.
So I think that leads to me having, anxiety issues and mental health issues
Okay.
all around. Yeah.
Awesome. All right. And yeah, and another thing I'd also like to mention, not to interrupt you,
No.
if there's anything that you don't want to talk about, feel just free to share what you feel comfortable with too. Like I know that a lot of the questions I'm probably going to have are going to be personal. So just feel free to share with what you're comfortable. So you're doing
Yes.
great
Okay.
too, by the way. Thank you.
You're welcome.
Awesome. Okay. So let's move on. Considering the community that you live in now on the south side of Chicago here, um, what changes would you like to see in your community to address climate change and improve health for all people? Um, so I guess what I want you to consider when I'm asking this question would be like an example would be like, would there be a change of policy or like a change in education or like in infrastructure change, like the public transportation system or like your local grocery store? Like those would be infrastructure changes that could definitely impact health. Um, so like what changes do you think could better people's health, your health, and the people in your community?
Well, in my community, I would have to say, um, well, those 2 points, transportation and, access to um, a full-size market, because in my area, we do have food sources, but they're more of the convenience stores where you can get like snacks, but not real food. You'd have to travel to get to a store that has ample, variety, fresh food and things like that. And there are transportation options, but they don't run 24 hours. Some of them are limited. So you'd have to walk to a busy intersection in the area, to catch um, a bus that would take you to a train or to um, a store that
Of-
has everything you would need, yeah, for a healthy, balanced meal, I guess. Yeah.
Okay, so it could, depending on where you live, it could be a journey, right?
Yes, definitely. I mean, if you live closer, I mean, you could get a lot more things, right? Instead
Mhm.
of going to the store and it's far, so you only get limited items. And,
Yeah,
so yeah,
definitely. I see what you mean there. Those two things are uniquely intertwined, when it comes to health. Yeah,
that's
definitely.
right. Yeah.
All right, great. So the last question that I have for you from the preset questions that I was provided with is here's a statement. I'm learning about how health and climate change interact. Is there anything else you think that I should know um, when it comes to health? So like mental health and climate change. Um, what do you have to say on that?
Well, I guess when something happens because of climate change, and hurricanes, they attribute that right to climate change. They get stronger because of it and so forth. Everyone, when they're helping, they tend to just worry about the physical things that happen, during a storm or during an evacuation, right? Everything that they can see is what matters, right? And they're helping, which I'm thankful and grateful. But then that changes, right? Because the news cycle is what happens, right? As soon as something else happens, everyone moves to the next story, right? And it's not to say that that's just how it is, right? But nobody pays attention to the after effects of of uh of what happens to someone, when they have to leave their home because of a storm, um, or or any kind, right? Flooding.
Definitely.
Uh, you know, I feel that they forget about the mental struggle that people are left with after that. And like for me, I have issues that I attribute to all that experience. So
Mhm.
yeah, so that's what I would have to say. Pay attention afterwards, and help people, um, you know, with their mental health issues.
Definitely. Yeah, I get you. So it's like, you know, for shock, on the news, like you see like these pictures of like houses that aren't there anymore. You can tell they were once houses, but they don't look that way anymore. Or they're underwater, or things that you can see that can grab people's attention, but maybe that doesn't necessarily carry over to like the unseen struggle, like having to move all the way to Chicago, literally half
Yeah,
across the country, and start a new life with children that must have been crazy, incredibly difficult. And those are the things that you don't really see because the news,
yeah,
yeah, you're right. The news does pay attention to it for a particular amount of time, and then sure enough, something's bound to happen and the world moves on,
yeah.
except for the people who live.
Who are living it or live through it. Yeah, for sure.
Gotcha. All right. So I am just going to move on to some questions that I have that I just want to follow up on. So I guess for my first question, pardon me, hold on one second. Paper dropped. The first question that I wanted to ask you, okay, so Hurricane Andrew, that was like one of the biggest hurricanes, in a news cycle in the last century. Like that was huge. The amount of people
Yeah.
that were displaced. It when that occurred, I was so young. Like of course I could not remember that. But there are a lot of people here in Chicago who have moved up here from there. And can you like expand upon that? Like how was that process? Like what was that process like when you moved from to escape Hurricane Andrew and find uh, a new home in the north?
Yeah. I mean, I was young too. I was about 8, 7 or 8 years old. 7 when that happened.
Okay.
And my parents got the order to leave. So I do remember seeing them, you know, I remember the situation being chaotic, they getting everything needed for the move, trying to find somewhere to go, right? And then finally finding, a distant relative that we could stay here in Chicago. So I remember packing up our, the family car, and then just driving,
Right.
driving and stopping and, for meals. So I remember that. I remember arriving, to a new um, city, I guess. Yeah, and just being young and being scared
Yeah.
of new experiences, I guess. Yeah,
I can imagine being that age. I mean, you're forming the way your views of the world and like, just the adult that you become as the child and how the child experiences it at that age. So yeah,
yeah,
definitely. Um, that actually leads me into my next question. So like this happened, what, 35 years ago, right? So like
yeah,
about
around there.
35 years.
Yeah,
So
32, 30. Yeah, around there.
So let's dive into that a little bit more. Um, let's talk about the impacts that you had when you were a child. So, like, yes, that was really scary. Um, do you think that this might have led to like the development of like some of your mental health issues or like your anxiety? Um,
Yes.
yeah.
I mean, because right now I'm definitely afraid of water. Like I don't swim. I don't swim. I don't like to go near. I mean, I go near the water, right, the beach, but I don't go in the water. I admire it from afar. So there's that. That's a trauma for me. Just because when that happened, there was a fear of getting, flooded and getting swept away and things like that. So that gives me fear. So
Mhm.
there's that. And I think that leads to other thing. I feel that that's why I have OCD, maybe, that could be a reason, you know.
Yeah, definitely. am glad that you weren't there to experience it,
Yeah.
or at least that terror of like being in rising ocean water in your home.
Yeah.
But essentially that's what would have happened, right? Your home
Yeah.
was no longer there. It was
No, it's not.
gone.
Yeah. It would have
So
been, we would have died. Yeah.
yeah,
I mean, it was I mean, it was terrible.
well, just
It was a
imagine
terrible.
like your two parents and like you said you have three sisters and two younger brothers.
Yes.
So that's including you. That's six children and two parents.
Yeah.
They made the right call in doing that,
Yeah.
especially being as young as you were. So that's great and
Yeah.
that you guys made it out.
Thank
Uh,
you.
definitely. So yeah, that is a good segue into my next question. Let's
Sure.
brush up on your family. Let's mention, so you have two brothers, younger brothers. You're the oldest boy. And how old were your brothers and sisters happen? You said that they were older. They would have been your sisters would have been teenagers and your
Yes. They would have been they were teenagers during that time. So, they were in their own world.
Mhm.
So, yeah.
Yeah, your
So
sisters were like out the door, but like as far as your you
yes, like what is that phrase? One foot in, one foot out, you know?
yeah.
So, yeah. So it was
Okay.
just my parents and me and my brothers,
Yeah,
because my sisters were, you know, already wanting to be on their own.
exactly. Um, right. Hold on just one moment. Here we are.
Yeah, sure.
All right. And then Also, another thing that I wanted to mention, your younger brothers, they weren't of an age to like remember that at all, right?
No, they were too young. They were too
Yeah.
young. Yeah,
So
definitely.
they don't remember a time living there. Their
No, they
thoughts
don't
are
remember.
okay. Okay.
Yes, here in Chicago. Yeah, no.
Gotcha.
Florida is not their home city,
Yeah.
not their hometown. That's how they say it.
Yeah. Right. Okay. So let's move on and um talk about your mother and father. And here is where I just want to like just reinforce too. Like I know that these are super personal questions, and you totally don't have to be specific, in detail.
Yeah,
But if you could just please share as much as you're comfortable with, that would be great. Um, so Hurricane Andrew happens, right? Your mom and dad have three older girls, yes, admittedly out the door, but three young boys that and they just lost their house. They moved across the country into a home that took them in, being eight people. Like that's a lot.
yeah.
That could not have been easy for them. Um, so how did this impact their relationship? How did that turn out?
Well, I think the whole move here and having to evacuate their home, right, I think led to their separation because my dad, bless his heart, he turned to alcohol and drugs and then was very abusive towards my mom. So they separated. And after that, we lost track of him. It's not like my mom kept up with him, because things got really bad during that period. So I'd say it deeply affected my family when it comes to uh, you know to having come here because of that circumstance, right? Because it's tough, right? Because it wasn't easy coming here. It's not like we had another home waiting for us here. We had to share what we had with another family that kindly took us in. So that I'm grateful, but it was tough. I remember being cramped in a room, right, with my entire family. But it's what we had, and it's what we made it work. Unfortunately, you know, um, my dad did pass away, and I did end up reconnecting with him, right? So that was something that I'm grateful for. But yeah, so I think that's that. Yeah. So
Yeah, totally. I get you. I understand. I think if there's anything that I can, just add upon, if it's even my place or anything, but there's one trend here, and like this whole thing is just the toll that like these things take on your mental health, whether it be you, your mother and your father and their relationship, and essentially like what that meant for you as a kid. You know, what happened between them was what happened between them, essentially. Like that's between them. But I guess what I'm trying to say for my next question is like, how did that dissolution of that bond affect you in the years going forward? Um, having one parent, having your mom.
yeah, I mean, it was tough. I mean, I grew up without a father figure, and my mom had to, take on a double role, right? She had to raise, um, six kids. So I saw her struggle. I saw her, go through hard times. Um, but she made it. She got us all to adulthood. So, she did great.
Yeah.
But I saw them, I saw the separation, it played out in front of me. At least the kids that understood what was going on, we got it. We knew that things were bad.
Yeah.
Yeah.
For God. Okay. Awesome. Thank you so much for sharing that. I appreciate it.
Yeah, you're
Yeah,
welcome.
definitely. So I guess taking that impact of growing up without a father due to, whatever happened between your mother and your father, the divorce, um, do you feel like as if that event that happened in the past still plays an impact on your life in adulthood? Um, and what degree does that have on your mental health today in this moment?
Well, I mean, like I had said earlier, I do suffer from mental health issues now as an adult. I do have anxiety, depression, and OCD, and those are sometimes they can be, um, uh, somewhat debilitating, right?
Mhm.
Anxiety can, um, can prevent you from being social or being in, situations where there might be a lot of people, right? So that's tough. Um, and I wish I didn't have them, but they're there, so I just have to deal with them. Um, but sometimes when I do think about them, I'm like, when did it start? Because I don't recall feeling this way before, you know? Everything started like once we moved. Once we moved, these new feelings were emerging that, what are they? What are it's anxiety. I was nervous all the time. Just a life filled with anxiety, which is not, I laugh because, I make light of serious things because why be serious all the time, right?
Right.
But it's awful. It's having severe anxiety and couple that with depression and OCD. It's tough.
It is tough. Yeah. Thank you. Um,
Yeah.
yeah, definitely. I can definitely relate to you there.
Yeah.
And living with a life full of anxiety, I think that's a common theme for a lot of people. So
Yeah.
you're not alone in that at all.
Yeah.
Um,
Right.
okay. So drawing back on this idea of anxiety, would you ever consider moving back to South Florida? If not to the Miami area, maybe to the Gulf, where there's a little bit less of a chance for a hurricane. Definitely still happen there though, but
Yeah.
would you ever consider moving back there?
No, I don't think about it often. I, afraid of water. So, you know, there's a lot more danger of flooding over there than it is here in Chicago. Our greatest threat would be snow, wind, right? But not that drastic type of weather, So I think I'm okay here in Chicago. It's been my home for such a long time. It's I love it here. So no,
Chicago.
no, not
Yeah.
at this time.
All
Not at
right.
this time. No.
All right. I got you there. Excuse me. Okay. So, Chicago, what stands out to me here? So earlier you mentioned that in your community, right, on the south side of Chicago, that you wanted better access to full-size grocery stores. Um, so how long would you say that it takes you to get to your current store? In like whatever way you access it, and like how do you access it? Do you have like different ways to get to the store? Is it just one way? Do you have different options to choose from? And then if you did have that better access to grocery stores, what would that mean for you and your community?
Well, again, I don't have a car, so I rely a lot on public transportation and I do a lot of walking because I have to walk to get to a bus stop that'll get me to a bus that'll take me to a train, right? And from a train, right, you can practically get anywhere, but it's the part about, getting to the train. I'd have to walk, I guess, like good 15 minutes, right? To get to like a main uh CTA bus stop, right? That runs 24 hours, that has constant buses passing through. Um And then from getting to that bus, going to the store is like 30 minutes, right? 'Cause- And then being at the store, a choice is made, right? You can either buy, a grocery haul for the week, right? And then struggle with that all the way back home, right? Because sometimes buses are not empty, they're full, right? So if you buy a lot of groceries, I have to carry them with me, even on the bus. Like I can't just sit down or put them down. The buses are packed. So,
Yeah, so you're
uh,
you've got your arms full. Like that's of course, yeah, that's not
yeah.
comfortable.
So I
So
can either go and do that, or I can go and just buy what I need to make for like a day or two. And that's just not doesn't work, because then I'd have to go back in
that's
a few
not
days.
realistic. Yeah,
Yeah, no.
that's a chore.
Yeah.
Um, an hour on the bus round trip. That's bonkers.
Yeah.
If you ever need a ride, it will give you one.
Thank you.
Yeah. Okay, so transitioning from the idea of having a grocery store closer to you, let's move on to transportation. So like transportation is a concern for you. Like what's the current state of transportation near you beyond just getting groceries? Like maybe um going to the hospital. Like can you get to where you need to go quickly if you need to? Because like if you can't get to the hospital for like say you get stitches and you just need stitches and like it's not you have to go to an emergency room to get that taken care of, but it's not a life or death situation.
Yeah.
So your choices would be either an Uber or public transportation. So a couple bucks or, how much ever it would take you to get to a hospital. What else does those transportation issues have impact on your life and in your health?
Yeah. Well, if I want to get somewhere quickly, I mean, it'd have to be an Uber, and that's expensive. Ubers are not cheap anymore. As far as public transportation, if I need to get somewhere quickly, I'd have to plan for time. I'd have to leave extremely early to get to where I need to be on time
Mhm.
because there's just not easily accessible bus stops in my neighborhood. Like I'd have to walk to get to one, and that's the part that's kind of like exhausting because you have to walk to get to a bus, you
Yeah.
know. So
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 your
yeah.
your options are long
I mean,
commutes
yeah,
and paying like a reasonable amount, paying an expensive Uber, or like say like if you had to go to the hospital, like that would be thousands of dollars to not really even go that far.
yeah.
Yeah.
And I'm all for walking. I'm all for walking, but the walk to the thing is like about 20 minutes, you
Yeah.
know. I'd kill for a bus stop that was like 10 minutes, something a little bit more feasible. But we work with what we have.
Right.